Welcome to Section 6 of the Project Access Online Introduction to Autism. This section is going to cover basics of assessment for educational eligibility. At this point, we're going to return to review your Resource 4. As mentioned earlier, this is the Missouri 2011 State Plan Definition and Eligibility Criteria for Educational Autism. You already are familiar with the two major areas that are affected, those being verbal or nonverbal communication as well as social interaction. Then notice the definition includes a statement that the disability must also adversely affect the child's educational performance. It is possible that a child might have a medical diagnosis of one of the pervasive developmental disorders and still not qualify for special education services. This occurs sometimes because the student does not meet the first two criteria, but more often it is because the medical disability doesn't affect educational performance. This is particularly true in the case of students diagnosed with Asperger's syndrome. Or a higher functioning child may not qualify for services when he or she is moving from a young child with a developmental disability or YCDD eligibility to a school-age category. Missouri regulations allow children aged 3 through 5 who experience developmental delays in one or more areas to be labeled under that young child with a developmental delay. So, what is educational performance? While it's not clearly stated in the Missouri Compliance Plan, educational performance can have a broad meaning. Until the 1997 Compliance Plan, the Missouri criteria specifically stated that educational performance shall be considered to go beyond academic performance to include generalization and application of learned information. This is not explicitly stated in the 1997, 2004, or 2011 plan, but school districts would be wise to consider there is more to education than academic performance. There is a recent case law indicating that social skill deficits for a student with Asperger's can be considered as educational performance, even if academic performance is age and grade appropriate. Observe for and ask these questions. Is the student applying the material he has learned to novel situations? Can the student work cooperatively in a group setting? Does the student participate in extracurricular activities? Is the student participating appropriately with his peers in unstructured settings such as recess and time between classes? Is the student learning skills needed to transition to a post-secondary setting? You might think of other examples of educational impact besides grades and test scores. An eligibility category or label is the key that opens the door to special education services. It is important to remember the label does not drive services provided for the child. Services are matched to the individual needs of the child and are determined by the goals and objectives on the IEP, regardless of the child's educational label. We may need to explain to parents, medical personnel, and even regular education teachers that the child's medical label is perfectly acceptable for medical situations, and it will be cited in the evaluation report. However, federal and state education regulations mandate that one of the 13 educational labels be used to admit a child into special education. Some uncomfortable situations can be averted if your team makes a copy of this list and provides it to each person at the evaluation or IEP meeting. The educational assessment team should consider information gleaned from the medical reports along with the team's own findings, compare to the educational criteria, and determine eligibility. Another thing to remember is that using the educational autism category, schools can provide special education services to students who have no medical diagnosis at all. In the state of Missouri, it is not necessary for the assessment team to have a medical diagnosis of autism already given to the student. You may wish to download the Autism Spectrum Disorders Missouri Best Practice Guidelines for Screening, Diagnosis, and Assessment at the link on this slide. Here are the 13 special education labels we may consider. The speech-language impairment category is broken down into more specific criteria. A child who is 5, kindergarten eligible, may continue under the young child with a disability label if he or she was identified as such prior to attaining kindergarten age eligibility. Children who are first grade eligible, age 6 by August 1st, must meet criteria under a disability category other than YCDD if they are to continue to receive special education services. Much of the information useful in determining educational eligibility criteria for autism is informal and may include a review of records and reports, including medical reports, taking an in-depth social history with parents or other caregivers, interviews with teachers and or professionals, rating scales by those you interview, observations, interactions, completing multiple observations in different settings, including structured and unstructured activity, and gathering information from standardized testing, including an examiner's informal observations. You're familiar with this 4-quadrant area where you record the required criteria areas, which are communication, cognition, and relatedness. Those are your 2 mandated criterias, with developmental rates and sequences and sensory information as being the optional criterias. We reviewed this in section 1. Just a reminder not to forget your team can use it. It's a good information gathering instrument for eligibility criteria. So to review, scores on tests, as we've discussed before, are not your primary source of information in determining eligibility. Normed testing is not required. Cognitive testing is not required. And autism-specific testing is not required. Careful consideration of behavioral determinants is required, no matter what the source. When interviewing as part of the evaluation process, it is important to obtain as many perspectives as possible. Children may look and act differently in different settings. Caregivers and others may have differing expectations and concerns. What may not look like a problem in one setting may present significant concerns in another. The Autism Diagnostic Interview, revised, is used by some educators to gather information. It may be an instrument your team will want to consider. Project Access has also developed a parent questionnaire, which you will find located in your appendix section that might be helpful. Informational interviews are just that, simply talking with parents, teachers, and other persons involved with the person that you're assessing. It is important to review the child's history. Over time, concerns once present may no longer exist, but that doesn't mean they don't count. New concerns may have appeared. All are important in determining the presence of autism. For example, significant sensory concerns may not be present at the time of your evaluation because intervention has been successful, but that doesn't mean you don't consider it. History is true throughout the life of the child. So if there ever was an issue in the sensory area, it still counts when you're determining eligibility criteria. The GARS, GADS, and ASDS can be completed by the autism expert on your team, given to teachers and parents, or better yet, used as a tool to guide an interview with parents and or teachers. Best practice would be to have at least 2 people familiar with the student answering the questions from these instruments. These tools all yield an autism quotient or an Asperger quotient. The quotient is then converted to a probability or likelihood of autism or Asperger's, depending on which instrument is being used. However, it is not the likelihood of autism or Asperger's that is most helpful to us in making an eligibility determination. More helpful, once again, is looking at what behaviors have been noted. Those behaviors can then be entered into the diagnostic quadrant and compared to the DESE eligibility criteria. School teams sometimes struggle with the diagnosis of higher functioning individuals or in determining the eligibility criteria of higher functioning individuals. Remember, educational impact is more than just grades and academic performance. The team will want to gather and document information about the following. Look at academics. The child may be academically able or may have mixed success. Often these individuals are successful in areas of interest, but may have decreased skills or even failure in subjects that aren't interesting to them. And that takes you back to those interfering factors of learning, interest being one of them. School and behavioral problems are often what bring the higher functioning student to the attention of the evaluation team. These should be well documented. Especially important is a comparison of skills and behaviors in differing settings. Use of a functional behavior assessment, or FBA, is especially helpful in documentation and may provide a foundation for later intervention strategies. And we'll be discussing functional behavior assessment more in depth in our Working with Autistic Students in the Schools, or WAS training. While many higher functioning individuals will have good expressive language, their ability to use language for a variety of purposes and within a variety of settings is impaired. This is best documented by observation. There are instruments available to explore this area, and they are helpful, but they are of necessity, contrived, and sometimes it is best to use good observational techniques. Rating scales may assist in structuring information. These include, but are not limited to, the Asperger Syndrome Diagnostic Scale, the Gilliam-Asperger Syndrome Diagnostic Scale, and the Autism Diagnostic Observation Scale is a frequently used tool, and your team may wish to explore its use. A thorough review of history is important. Sources include school and medical records, treatment summaries, and teacher records. The team will want to document concerns over time. Later, knowing about intervention successes and failures will support IEP development. Be sure to look at previous medical diagnosis, behavior characteristics reported, communication history, emotional history, social history, and intervention history. Parents are integral and important members of the evaluation team. They are often our best source of information. However, the consensus of the team as a whole is what determines the educational diagnostic category. Best practice is to include someone on the team with a competence in autism. Competence is built through training and experience, but at this time there is no specific degree or certification required in Missouri. National organizations such as the Council for Exceptional Children, or CEC, or the American Speech, Language, and Hearing Association, ASHA, will have competency guidelines for their members. Universities may offer credentialing or advanced degrees in the area of autism and or developmental disabilities. Project Access considers completion of the Introduction to Autism, followed by either working with students with autism in the schools, WAS, or Early Intervention for Young Children with Autism, which we call ICA, to be a basis for competence. Remember, Project Access is an available resource to support your team.